Hello friends, in this video we will be discussing few important questions and we will learn that how to approach towards the correct answer. Either it can be by direct clicking the answer if you know the points, or it may be through the method of exclusion. When we are not knowing the direct answer for that question, then we have to use our knowledge or concept of that particular topic and we will reach to the answer by exclusion method. And I just want to share here one point, that if we can learn this trick of exclusion, which is not very difficult, but definitely you will learn by practice. And if you learn this trick or technique of exclusion, then definitely you will be getting 15-20 marks as bonus in your upcoming examination. And one another mantra of success I just want to share, which you can come across while facing any examination or in any situation in the life. Whenever you feel low, you have to believe in yourself. You have to believe in your hard work, in your confidence, in your dedication, that yes, you are giving more than 100% what you can do, what you can give. So you have to believe in yourself, and then definitely you will get the energy and you will get the answer from your inner core that yes, I can do, I can win. So always have the positivity. So now we will be discussing few important questions with their explanations, and the main purpose of this video is to learn that how to approach towards the answer. Now before reading a question, if image is given in the question, you first have to look that image, because by looking the image or identifying the image, you will limit your knowledge. What I mean to say with this, that you have to restrict yourself to the thoughts, to the knowledge of that particular topic only. And this will help you more focusing towards your answer. Second point is, when image is given, you had identified the image, and if it's a lengthy question, because nowadays the pattern is changing, they are giving you the clinical based scenario, and if a long 5-liner, 6-liner, 7-liner question is there, so sometimes by looking at the question, you may feel suffocated. Hi, itna bada question hai. I am having only the 1 minute time. How I am going to read the question completely? And what happens that if in the beginning you are giving more time to the questions, and towards the middle you are just getting irritation. Oh, how I'll be able to complete my whole questions in the given time, and this disturbs you and this breaks your concentration and you make silly mistakes. So point to remember here is that if an image is given, you have to identify that image. So to concentrate or restrict your information. And second is, in a lengthy question, try to read the last line or the last 2 lines first and then read the options. And I can say in around 80% of the cases, you are getting your answer without reading the first 3-4 lines. So that will save your time, and this will give you confidence if you are able to solve the question, especially the lengthy questions, in the given time. So here, as you could see in this image, it is that some mosquito is there and what it has been written, the fight the bite, stop the dengue. So it means we have to restrict ourselves thinking about the dengue fever as well as the causative mosquito for the dengue. And what is the causative mosquito? It is the Aedes mosquito. Okay, so this is in our mind that we have to restrict ourselves to the dengue as well as the Aedes mosquito. And mainly they are focusing that we have to stop dengue, means something they are asking about the prevention. So these are the 3 points which we can get from this single image. So we have to mainly focus on how we can do the prevention of the dengue, and quickly the reel should flash in your mind, or the video should play in your mind what you had studied about the prevention of dengue. Okay. Now we will see the last line what they say, that what is the level of prevention, whether it is primordial, primary, secondary or tertiary. So as we had already assessed by the image that they are asking about the prevention, but now here they are not asking about methods of prevention. They might have given us some method and they are trying to ask us that what are these different level of prevention. So within seconds, again the second reel should play in your mind that what are these different levels of prevention: primordial, primary, secondary and tertiary. Clear? Now as we could not get any hint that for which activity they are asking this level of prevention, so definitely we have to read the question. So question is, Delhi Chief Minister Mr. Arvind Kejriwal has given a campaign 10-10-10 to fight against a dengue fever. It means that on every Sunday we have to give the 10 minutes time at 10 AM for 10 weeks to look for any mosquito breeding sites, and we have to stop that mosquito breeding or avoid them. So this is the main catchword. So another point I can add here is that we should try to learn how to identify the catch words in the given question, because these catch words will make a story and this will help you in solving the question. So here they had given us a story like that we are trying to prevent the dengue by a slogan as 10-10-10, and what we means 3 activities we are doing, that for every Sunday we have to give the 10 minutes time for what activity? To look for any mosquito breeding, and we have to avoid those mosquito breeding. And we know that if we are avoiding the mosquito breeding, it means we are avoiding the risk factor of that particular disease, and definitely what level of prevention this is? This is your primordial level prevention. So here the catchword is that we have to avoid the mosquito breeding by looking for the breeding sites, and definitely we have to avoid that breeding places. So we have to avoid the risk factor, that is primordial, but if we are trying to avoid the disease in the presence of a risk factor, then it is your primary level prevention, and if you are early detecting a disease by various screening tests, it is your secondary level prevention, and if you are managing a disease in advanced stage, it is your tertiary level prevention. So quickly we will revise our different levels of prevention, and if you can recall, we had already discussed this in our detailed lectures, that how to differentiate between primordial, primary, secondary and tertiary level prevention. And if we see for the risk factor is present or absent in the primordial. Please answer with me so I could hear your sound through my heart. So what is about the risk factor in the primordial level prevention? Definitely the risk factor is absent, because our goal is that we have to avoid the risk factor, but it is present in primary, secondary and the tertiary level prevention. What about the disease? Disease is definitely it is absent in the cases of primordial, absent in the cases of the primary, because we have to avoid the disease in the presence of the risk factor, that is primary level prevention, but disease is present in the secondary as well as in the tertiary level prevention. What about the complications? Complications are absent in the primordial, they are absent in the primary as well as they are absent in the secondary also, because you are trying to detect the disease in an early stage before complications can happen, and yes, the complications are present in tertiary level prevention. And what about the disabilities? The disability or any death or serious complications, it is absent in the primordial, it is absent in the primary, absent in the secondary, or it may or may not be there in the tertiary level prevention. So, these are the 4 different levels of prevention, and if we say that which is the best level of prevention, then obviously the primordial level prevention is the best level of prevention, and which is the least recommended level of prevention is the tertiary level prevention. And if we say that in the prevention of the dengue, the most or the best preferred method is the primordial level prevention, where we are trying to avoid the mosquito breeding sites, and we all know that these Aedes mosquitoes, where they are breeding in the artificial water collection. So, we have to look for any artificial water collection, either it can be in the tires, it can be cooler, it can be in the flower vases, and we have to change this water every week. So, we can avoid the mosquito breeding, so we can avoid the adult mosquitoes to develop, that is the primordial level prevention. Or we can also do this primordial or avoid the development of the adult mosquitoes by putting some chemicals in the water which will be killing the larvas, and we all know that the chemical which is used to kill the Aedes larva, it is what chemical? It is Temifos or abate, because what is the situation of these larvas? The larvas, they are suspended from the surface. So, we have to put the chemical which is dissolving in water, and if you can recall, in Anopheles larvas, because they are sitting parallel to the surface, we have to put the chemical which will remain on the surface, and we are using the Paris green dust. So, Paris green dust is used to kill the Anopheles larvas, while abate or the Temifos, it is used to kill the either the Aedes larvas or the Culex larvas or the Mansonian larvas. Or we can also leave some Gambusia fishes which will be eating all these different type of larvas. So, these are all primordial level prevention, where we are preventing the development of mosquitoes. But if we are not avoiding this breeding, we can have primary level prevention. How? We are doing the insecticidal spray to kill the adult mosquitoes, or we can use various repellents, we can use the mosquito nets. We are preventing or avoiding the mosquito bite, preventing the disease. Now, secondary level prevention, it is usually not very much applicable in the case of the dengue, because we cannot screen out, but yes, we can do the early detection if any person is coming with a fever. So, we can have a doubt of dengue with the symptoms that the person is coming with a high grade fever with the chills, and we can check this dengue infection by doing a NS1 antigen test, and we can have early detection and can do the management. And obviously, the tertiary level prevention is in the advanced stage of the condition, whether the person may be either in the stage of dengue hemorrhagic fever or in case of dengue shock syndrome, and we have to manage. So, these are different levels of preventions in cases of dengue fever. So, the correct answer for this question is that it is primordial level prevention. Now, next question is, as again you could see, it is the image based question, and in the image you could see that it is the image of eye pill, and we all know that eye pill is what? It is an emergency contraceptive pill. So, it is something related to the emergency contraception. Now, what the last line says? The last line says that what is the level of prevention? So, again they are asking about the level of prevention, and it is what? Primordial, primary specific, secondary or tertiary. Now, here if we apply our knowledge of levels of prevention, where we are using the eye pill. Eye pill are usually used following the unprotected intercourse. So, risk factor is there, the intercourse has happened, but it has not converted into pregnancy. So, at any cost we are trying to avoid the pregnancy in the presence of the risk factor. So, it is your primary level prevention. And we all know that primary level prevention are of two types. It can be specific or it can be the health promotion. Health promotion means when it is applied to the whole community, and when it is being used by the individual person, it is specific. Now, obviously the IPIL is not used by the whole community at a time, so it is used by the individual person. So, it is your specific level prevention. So, I can say that just looking at this image and reading the last line, that level of prevention. So, I am about 90% sure that my answer should be primary specific, okay, but still I have to confirm to 100%. So, I will read the question. A girl went out to celebrate Valentine's Day with her boyfriend and they had unplanned sexual activity. So, girl was very much afraid, and on the advice of her married friend, she had taken tablet IPIL on the same day. So, this is what we had already discussed, that exposure has happened and to avoid the pregnancy she has taken the IPIL. So, obviously it is your primary specific level prevention. So, as I already said earlier, that by looking the image and quickly the information about that image or the video of that particular portion should play in your mind. So, you have to develop this habit, because all this exercise you have to do in 1 minute, or even I can say the less than 1 minute only, because you have to read the question, you have to understand, you have to recall, and your brain should answer that what could be the things. You have to differentiate, you have to do the differential diagnosis, and then finally you have to click on your computer screen that the correct answer. So, all this exercise has to be done in 1 minute. So, the time management is very important, and definitely you will learn this practice by doing more and more MCQs, by solving more and more questions, by appearing in more and more tests. So, here the correct answer to this question is, it is your primary specific prevention. Now, next question, annual health checkup for occupational workers under Factory Act is what level of prevention? So, here again they are asking about the level of preventions. Now, what we mean by annual health checkup? So, here the two keywords are there, the annual health checkup and the Factory Act. Now, we all know that Factory Act is designed for the better environment, better working hours of the workers in the industry, and this is to maintain the good health. And we all know that maximum hours permitted in the industry is 48 hours per week, or with overtime it is up to the 60 hours per week, and the minimum space available per worker should be minimum
500 cubic feet
per worker. And we are doing their annual health checkup. Now, at the beginning of the recruitment, we are doing their health checkup, and if we find that they are fit, only we are giving them job. But as they are exposed to the various risk factors in the industries, either it could be the inhalational substances leading to pneumoconiosis, or they are being exposed to the certain chemicals which can cause the allergic manifestations, which can lead to the malignancies also, or they can expose to the lead compounds which can cause the lead poisoning. So, what we are doing their annual health checkup, and the purpose of the annual health checkup is that we have to detect if any abnormal condition starts developing in these individuals at an early stage. So actually this is a type of screening technique or screening procedure where we are doing their annual screening and trying to early detect a disease, and if any person is found to have certain diseases, that person is removed from that environment and is being treated for that. So the disease will not advance and we can avoid the morbidities and mortalities. So obviously it's a early detection of the disease and its management, or it is a screening. So it will be what level of prevention? So your answer to this question is that it is your secondary level prevention. Okay. Next question is, again they are asking that what is the level of prevention? Now with the last line, we could not get any hint that for what procedure or for what activity they are asking for the label. A lady went to primary health center with complaints of the post-coital bleed. So one catchword, that lady is complaining of the post-coital bleed. So here quickly the point should come in your mind that what can be the causes of the post-coital bleed. So here you have to correlate your concept of gynecology also, that what can be the causes of the post-coital bleed, and we know that most common cause in the Indian situation could be underlying carcinoma cervix or any cervical pathology. So first possibility is the carcinoma cervix. On examination, the lady doctor said that I have to perform VIA or the Willi test to rule out cervical pathology. And we all know that VIA is nothing but it is the visual inspection of the cervix after applying the acetic acid, or the Willi, it is the visual inspection of the cervix after Lugol's iodine. And these tests are usually done as a screening procedure for early detection of the cervical pathology. And these are usually applied in those areas where we are not having the facilities for the pap smear. So as the question says that lady has gone to the primary health center, because the question can come in your mind that why we are going for the VIA or the Willi, why we are not going directly for the pap smear. Definitely the pap smear is better as a screening technique, but as this lady is going to the primary health center, and in the primary health center we are not having the facilities for the pap smear because we are not having the expert cytologist or the pathologist to do the reporting. So we are trying to identify the cervical pathology by this test, that is VIA or the Willi test. It is very simple test, and this is the image for the VIA test and this is the image for the Willi test. Now what we mean by the VIA and what is the interpretation, that is very important. Now VIA is the visual inspection of the cervix after acetic acid. Now what we do, we put a speculum in the cervix. So this is the SIM speculum or the self-retaining speculum is there, although this is the image which is showing the procedure of the pap smear, and you could see that with the SIMS speculum the cervix is being exposed, and this is the cyto brush which is taking the endocervical smear, and this is the IRS spatula which is used to take the smear from the ectocervix, and then this is, if you see the closer or the close view, this is the A group which is taking the smear from the ectocervix with the IRS spatula, and this is the endocervical brush which is taking the smear from endocervix, and then finally we are collecting in a container and sending for the cytological examination. So this is actually the pap smear, which is again a secondary level prevention or the early detection of the cervical pathology, but obviously this is applicable from the district hospital onwards. But in the periphery we are applying the VIA test. So basically what is the interpretation of the VIA test, that is very important, and VIA is the visual inspection of the cervix after applying acetic acid. So what we do here, because this is suppose a cervical pathology is visible, some cervical erosion is seen, and we don't know whether it's an inflammatory or whether it is a early stage of carcinoma cervix. So we are putting the Simpson speculum, exposing the cervix, and what we'll do, we'll apply the glacial acetic acid over this cervix. Now this acetic acid, it is having the property that it is forming a white coagulum with the protein, and we all know that pre-malignant cells, they are having the more of a nuclear material. So nuclear chromatin material is more, and it is made up of the protein. So if we find this aceto-white patch, what you could see here, this is the aceto-white patch is there, and this suggestive of there is a underlying more protein, and this could be because of the proliferation of the cells, abnormal proliferation, and this area is suspicious. So by applying or after applying the acetic acid, if we find any white patch, so this white patch is suspicious, and then we have to refer this lady to higher centers for further evaluation with the pap smear or the colposcopic guided biopsy. Or we can apply the Lugol's iodine. This is again called as a Willi test. Now this is your initial cervix, which is appearing after applying the after putting the Simpson speculum. We had exposed the cervix, and we are now painting this cervix with the Lugol's iodine. Now here the interpretation is different from what was seen in the acetic acid, and here the interpretation is that Lugol's iodine, it is when combines with this starch, it gives like this purplish blue or a dark blue color. And we all know that healthy cells are having the good amount of the starch, and if it is a pre-malignant cell, because they are rapidly proliferating, so they are utilizing their starch in their proliferation, because energy unko chahiye hota hai, so they are utilizing this starch. So these pre-malignant cells are having the lesser amount of the starch. So here the healthy area is giving you the purplish blue color, and the colorless area is suspicious. So in the inner portion, what you are seeing, it is a colorless area, this is your suspicious area, and this outer area is your healthy area. While interpretation was different in the Via test. In the Via test, the aceto-white patch was your suspicious, and the non-aceto-white area was your healthy. So in the Via, the white patch is suspicious, while in the Willi, it is the colorless patch is suspicious. So this is actually again done for early detection of a condition, that is a screening procedure. And these are the another image of screening of breast cancer, and we know that first screening test is the self breast examination. The lady is supposed to do the self examination of the breast every month, preferably the post menstrual phase, to look for any lump, and here she should palpate not with the fingers, but she should try to palpate with the flat of the hand in all the 4 quadrants, along with the palpation of the axillary lymph nodes, because with the flat of the hands she will be able to appreciate the node, because if she is palpating with the fingers, then the fat globules may also give a feeling of the lump, and it can be the misinterpretation. So she had to palpate with the flat of the hand, and if she finds any of lump, then she should go to a clinician for further evaluation. Okay. So this is the different methods for the screening of either the cervical cancer or the breast cancer. So obviously the correct these are few more images for screening, and this image, as we are in the corona pandemic, and we may find while entering in the hospitals, entering in shops or the malls, our temperature is being checked. So this is a thermal screening, and this is just to detect the temperature, because it is an indirect reflection of the underlying infection. Or this is the technique of taking the nasopharyngeal swab wherever we are suspecting the person having the infection, especially if any positive case is detected in the family, then the close contacts of that positive case are being screened out. So these are the different screening activities, and we all know that screening is secondary level prevention. So the correct answer to this question, whether lady has gone to the primary health center with a complex of the postcoital bleed, and the Via or the Willi test was performed to rule out the cervical pathology, so it is your secondary level prevention.